Dr. Todd Clark here, a practicing ER physician in the Chicago area. I'm in the ER part-time these days, have been for a number of years, as my full-time job is a medical director of Clinician Experience here at Athena Health. And I came to Athena Health by way of the merger once from GE, where I was working on the Athena practice and Athena Flow systems previously for about 10 years. So very familiar with those systems. And what I'm here today to do is to show some of the highlights and differences between Athena practice and athenaOne clinicals. Now we're going to start off with Athena clinicals on the desktop. We're also going to then show you the athenaOne clinicals provider app on the iPhone. And that is going to include one of our newest and greatest features, which is Ambient Notes, which basically listens to the conversation between a provider and a patient and generates that note for them. So with that, let's go ahead and dive in. So the first thing you'll notice that's different about Athena clinicals is that we're a web-based platform. So you can see that immediately that you log in with a simple username and password on any web-enabled device. This is really nice because if you happen to be on call somewhere, you're a hospitalist going between settings and you need to access Athena clinicals from another computer, say your brother-in-law's computer, you're with their house for dinner, you can just pop open their laptop and log in. It's not a problem whatsoever. I'm going to go ahead and make the screen full screen. That's another thing that's nice about it being a web page. You can enlarge the screen. It's got spell check, all those things that are, slight differences with Athena practice. So there's a number of other things that are part and parcel to Athena clinicals that I can't show you, but I want to talk to about before we dive in and see a patient. These are invisible things that run in the background that make a huge difference because Athena clinicals isn't just software. It's also a lot of services wrapped around the software. Some of those services are automated. Some of those services are via AI. Some of those services are with real people. So I'm going to speak to each one of them very briefly. First and foremost, my schedule is dense because Athena clinicals performs automated eligibility checks, make sure that we're going to get paid for the services we provide. We also do automated appointment reminders to patients. We send those out and patients can respond, whether they received it via text or phone or through the patient app. They can say yes to confirm, 2 for no, and 3 to reschedule. We can even allow them to self-schedule if that's something that you want to empower your patients to do. The flip side of that is what we call call campaigns. So for example, maybe Cindy here was notified that she was overdue for a mammogram through one of our call campaigns. This is a campaign that can be scheduled to run periodically where you identify all of your patients that are due for a preventative health type of service, whether it's a mammogram, colonoscopy, follow up on their diabetes, and generate a list of whether it's 10 or 10,000 patients. Athena then picks up the list of patients and sends out personalized messaging to those patients through what we call our call campaigns. So again, your staff didn't have to lift a finger and you've already tracked down, identified, and helped out, potentially thousands of your patients. Similarly, Athena applies our economy of scale and collective intelligence and some automation when it comes to your inbox. And in particular, what I'm talking about here is our one-of-a-kind document management system, which intercepts all of your inbound faxes through AI and people, classifies the document, figures out what kind of document it is, which patient it's associated with, and goes the one step further than I think anybody else can do. We figure out if there's any associated order with that result that's coming in. So whether that's an MRI result or a consult note from the cardiologist, we can then close the associated order. Of course, if those results come in through an interface, we're going to close that order as well. But this ability to do it with a document that's been faxed is really unique. And what it does is it rounds out our very robust closed loop ordering system. Because each order in Athena, whether it's a follow-up order for an appointment or a lab order, consult order, they all can have alarms baked into them so that if we don't have those results in, whether interfaced or faxed, that order will fall into a needs follow-up bucket because it has been too long. We have not yet received the expected results. So here, for example, Betty Holly is due for a note from the cardiologist. It's been several weeks. It's past the alarm, and so we know that we now need to reach out to Betty or the cardiologist and find out what's going on. So that's part and parcel, again, of Athena's mission to kind of wick away menial tasks from your providers and your clinical staff. One other way we do that is you no longer have to go through those time-consuming upgrades periodically. You're always on the latest and greatest version of Athena. One of the other things that it means when we are web-based is that we can monitor your clicks on a page. So, for example, we can see if Dr. Clark, you're taking 20 clicks to get through a visit that most clinicians get through in 5 or 6 clicks. Can we show you some personalized methods of improving your efficiency through our accelerators and other clinician coaching? All these services that I've described so far, whether it's patient reminders, call campaigns, the document management, clinical coaching, this is all included in athenaOne. As a platform, we think it's critical. We know that your success is equal to our success. Your provider's happiness equates with our happiness and satisfaction. So just really wanted to emphasize those points before we go in and see Jake Medlock. This is going to be our first patient. Now, as I'm looking at my schedule here, there's a couple other things that I really want to point out that are different between athenaOne Clinicals and Athena Practice. First and foremost, we have telehealth, which can be baked right into Athena Clinicals. This is a simple link that the patient gets texted at the beginning of the day when they're having their telehealth appointment, and a reminder to join when it's time for their appointment. You can even send messages to the patient that maybe you're running a little bit late, and you can join similarly here from within the Athena desktop or even the mobile app. You'll notice that I have prepped here associated with Jake's chart. I can start prepping Jake's chart from the moment he's scheduled, so I can start skeletonizing my note, drafting orders. I may even want to go into our care gap work list where I can see, regardless of the reason that Jake is coming in, all the different services he may be due for related to his care, and utilize that to help draft up orders for his upcoming appointment. And so this is our ability to integrate some population health information into the system. And what that looks like is this. This is our care gap work list. And here we can see that Jake in particular, here's the status of all these various quality measures and guidelines that Jake falls into because of his age, gender, and problems. We're also fed with information from outside payer sources. So whether that's from our population health solution or whether that's from Humana or any other variety of payers, we will also have their information integrated in for the most up-to-date and robust picture of Jake's health. One of the other key things that I think is really important to point out is if labs come in, and maybe multiple labs on Marcus Taurus here come in, you can review all those labs. Any abnormalities jump out at me in nice red, bold format. But once I review all these labs, I can sign off on all of them at once and message those over to the patient. I've got an indicator, if the patient is registered for the portal. I can add notes to the patient about how things look. And I can even use some dot phrases there. Maybe I want them to come in as soon as possible to get seen. And I can, of course, save this or add orders or even schedule a follow-up. I'm prompted as to when the patient's next office visit is. I've got his home phone number up here in the banner to help drive efficiency within the system. And another difference is the ability to sign off in bulk, whether it's prescriptions, vaccines, labs, or DME that was queued up by your staff. All you have to do is click a single box and then sign off and approve those orders en masse. As soon as the patients are arrived, a clock starts ticking, and as they move through each status within the clinic, moving from arrived to ready for staff, to being seen with staff, to ready for provider, and then finally seen by provider and checked out, we're tracking all those times and throughput, and you can run throughput reports to see where you might be having bottlenecks. And again, our customer success managers are going to help you digest some of that information and figure out ways to drive efficiency for you. So those are some distinct differences I definitely wanted to highlight between Athena Practice and Athena Clinicals. Let's go ahead and see Jake now. So when I enter into Jake's chart, there's a lot of nice design features here that really help me focus on what I need to do today. First and foremost, my intake staff's information, vitals, appointment reason are all right here front and center. But also I'm prompted with my last assessment and plan on the patient so that I can quickly get up to speed as to where we were the last time we met. And I can see that he was trying to diet and exercise to lower his cholesterol. One of the other things that's nice on this page is I can look at the recent activity for this patient. So this is going to be the delta between the last time I saw him and his visit today. That's going to include not only things that were done associated with our plan to follow up on his cholesterol, such as his lipid panel here, but also the fact that maybe he went to an urgent care in an outside facility, and that is visible to me here in this recent activity as well. We're integrated with Commonwealth and Care Quality, allowing us to pull in records from outside ERs, urgent cares, hospitals, even other ambulatory clinics that are on those nationwide file sharing networks. Much of the ECW, NextGen, Epic, and other clinics are also integrated in, and we can pull in the records from those outside entities. We can extract from those records allergies, problems, labs, vaccines, and even reconcile those into the patient's chart. So thinking about the fact that we would like to get caught up to exactly where we are with Jake, I'm just going to go ahead and open up his lipid panel that we'd ordered the last time, and here are those results. And unfortunately, it looks like Jake's lipids are still trending in the wrong direction, and so we are going to have to, in fact, start that statin after all. If there were any outstanding orders that Jake did not have completed the last time he was seen by me, those would show up here, as well as any follow-up appointments that he has scheduled or that he needs to schedule also show up here on the patient briefing page. So you can see you get a really nice snapshot of exactly where we're at, where we were, where we're at today, and where we'd like to be. I do have the ability to navigate through the patient's chart over here on these left-hand tabs, including a nice search capability where I can simply enter a few keystrokes and find whatever I might be looking for, whether it's that cholesterol panel or maybe a consult note from the ophthalmologist, or even a continuity of care document. So quick and easy to get to those findings. We do extract the patient's medication lists from their medication fill history, and we can display those right here within the patient's chart. That can even include the trend of dosage, when the patient picked up their medication, when it was prescribed, when it was filled, all that good information, so that, again, you have a really clear and full picture of patients' compliance with medications. We're also integrated with your state vaccines, so we're a vaccine registry, so we're going to display those prominently. And there's a lot of other nice features within the chart that you can take advantage of. One of those is also the fact that we track quality measures, and our tracking of quality measures is not dependent on clinical chart updates the way that they are in Athena Practice and Athena Flow, meaning that as soon as results come in, they are going to start satisfying these measures. So if Jake had a colonoscopy and the colonoscopy report came in, not only are we going to close that associated order, but it is going to satisfy this quality measure for colorectal cancer screening. Similarly, if I look at the patient's problem-based flow sheet, in particular, maybe I want to look at his cardiovascular risk score. If the patient had a new lipid profile, which he did, that lipid profile is going to impact his 10-year ASCVD risk, and it's going to automatically recalculate that for me. I don't need to do anything for the system to recalculate this metric. All right, well, after looking through Jake's chart a bit there, I'm going to go ahead and dive in and see Jake. Good. And I'm going to be using a combination of methods of doing my documentation. When I first go into the patient's note, you'll notice that his problem list slides open for me automatically as a point of reference. In the middle of my panel, I have a preview pane, which is going to get me up to date on some other information that's going to be relevant to today's visit in particular. And that includes the reasons for visit that have already been documented. Now, remember, these might have been documented by myself ahead of time. My staff might have contributed to this if that's something that you want them to do, but this could all be part of chart prep. But let's say that while I'm talking to Jake, he says, Doc, in fact, I've got a skin tag that's been irritating me since I started exercising more. I'd like that removed. So I can go ahead and add that as a new reason for visit, and he would like to have that removed today. So I just want to show you that, it's quick and easy to add those reasons for visit. It's going to add that skin tag to the patient's problem list, and even can queue up orders for like a procedure template that we're going to get to in just a minute. Now that I can also review here the patient's vital signs, that blood glucose that was done as a point of care test as an automated test, simply for the fact that the patient's coming in for follow-up of his diabetes. We just have that as a protocol, so that was in place. No one had to go in and enter that order. They just entered the results. Similarly, Jake might have been automatically prompted to fill out a PHQ-2 during his check-in process. If that's something that he was due for, maybe I do that annually, and he was due for that this year. Through our patient app, patients can fill out any number of screening questionnaires, and those will be automatically ingested and displayed here in the patient's chart. So as I'm talking to Jake, he also says, Doc, I'm running low on my metformin. Can you renew that for me? And quickly and easily, I can click this arrow here that's going to, what we call accelerate metformin over. You can see as I hover, it gives me information about the last time I prescribed it, who prescribed it, and puts that metformin in. One-click renewal, very simple and easy. The other thing that's great about this is I didn't have to change screens, right? I didn't have to open a dialog box. I simply slid open his medications drawer here, added that in. There was no mental switching of screens and complexities that can come with that. So for his HPI, I'm going to go ahead and use voice to text. This is what we call Athena Voice, which is our partnership with Nuance, where speech to text is embedded right within the athenaOne mobile app as well as the desktop app. So anywhere and everywhere I go, I can use speech to text. Patient presents today for follow-up of his cholesterol labs period. He's been dieting and exercising more lately to try to lose weight and get his cholesterol under control, but his recent labs do show his cholesterol remains high period. We've talked in the past that we'll have to start him on a statin at this point period. He's also noticed that he's got some irritation of the skin tag under his left arm from this increased exercise recently. He'd like to have me remove it today, period. Go to review systems. Stop listening. So you can see there's some ability to navigate through the system with voice because of my the embedded Athena voice features. Now, if I wanted to add a review of systems to this patient, I can, of course, click through template choices like this. I did want to demonstrate the use of templates here. I can also, though, use what we call a save findings. This is my personalized choices of that template. This is a typical review of systems I ask my patients, for example, which is unique to me as a provider. It was quick and easy for me to save. Once I had that template in place, I made my selections, I clicked this star, saved it for myself, and then it's always there for me to use. For a physical exam, I'm going to go ahead and pull previous. So this is another, I just want to demonstrate another means of documentation within Athena Clinicals. When I go to pull a previous HPI, review systems, physical exam, I'm going to be prompted with both the date and the user that generated that previous piece of documentation, and that way ensure that I'm drawing on the correct piece. Here you can see that this was a dedicated PE related to specific to diabetes. I could see that by the fact that I'm doing my monofilament test down here. And more or less in this patient who's got chronic medical problems, not much has changed except for the fact that now he's got a new skin lesion and I can add that in. Now there's no skin lesion on the template, but I can put in skin tag, left axilla, red, irritated. So you can always add on the fly. The other thing you could do to supplement your documentation is utilize something that we call Athena Capture. This is a HIPAA compliant photo app that is on your phone. It does not store the photo on your phone. What it essentially does is creates a link between this QR code, which is linked to the patient's chart, and then whatever you take a picture of. So here I just pointed my phone at the screen, took a picture of the patient's skin tag, clicked upload, and in just a few seconds, you're going to see that appear within the patient's chart. And so this is useful not only for a physical exam where you might be tracking a mole or a rash or a skin lesion, but also in a procedure. You can add these pictures into a procedure. You can also utilize Athena Capture to upload documentation, so paper documentation into the patient's chart. So here, for example, I'm going to go ahead and document my procedure. This procedure is going to be automatically mapped to the procedure code so that I can make sure that I'm going to bill for and collect on everything that I do for the patient. So you don't have to remember to enter that code later on. So at this point, I'm going to wrap up his assessment and plan. The system does call my attention to the fact that Jake, as a complex medical patient, might have multiple medical problems that need to be addressed this year in order to treat him with the sophistication and complexity that he needs. So what we do in Athena is we track the patient's risk score associated with their HCC-related problems. And if the system notes that I haven't addressed all those problems this year, it's going to give me a prompt, but then I can jump over into the patient's risk dashboard and see all the potential diagnoses that the system has identified that would impact the RAF weight of this patient's risk score overall. So, for example, we know that in a previous year, we treated Jake for diabetes with complication of neuropathy. The other thing that we do, though, besides looking internally at claims that we've submitted over the last 3 years, is we offer up information from payers. So here, for example, a payer may have paid for a medication related to COPD, and so we're surfacing the fact that some provider at some point diagnosed this patient with COPD. It's not on the patient's problem list. We have not addressed it as an HCC code yet this year. We should, and Athena is prompting the provider to consider doing so. So we did see him for his hyperlipidemia today, and I do want to start him on a statin. So I'm going to go ahead and add my medication. The system's watching my prescribing habits, my ordering habits, and it's surfacing my most frequent prescribing and ordering habits to the top of that list. So nobody has to manage this list as a curated list for me as an individual. The system's just doing it for me automatically. Makes it almost one click for me to go ahead and enter this. It put in all the pertinent information. All I have to do is enter the duration of therapy. The patient's preferred pharmacy is automatically filled in, and Athena keeps track of all those directories, by the way, for pharmacies, providers, imaging centers, all their phone numbers, fax numbers, addresses. We provide maintenance of those directories, which is different than Athena Practice and Athena Flow for you admin folks out there. We also allow you to add and subtract pharmacies on the fly, anywhere and everywhere that you're prescribing medications. Once you enter that duration, we can then do a calculation with our prescription benefit managers, ensure that this is a covered medication, and get real-time benefit checks from them to see what the pricing would be. If there's an alternative to that medication that might be cheaper through a different formulation or a different pharmacy, we will offer that up to you as well as something that you could select. One other thing I'll point out here is that Athena owns Epocrates, so we have Epocrates monograph embedded right within Athena. The prescription drug monitoring report is also available in the assessment and plan and in the patient's medication list. Again, anytime you're looking at the patient's med list or prescribing, the PDMP is visible to you, and simply by clicking on these chevrons, you'll be able to see that report, and we're logging your activity of viewing that report in the background for auditing purposes. Now, I do want to put in a simple bit of text regarding treatment for this patient for his hyperlipidemia. And again, remember I mentioned here that this is quick and easy to save as a custom field as well. So if I had just typed this, for example, and I wanted to save it for the first time, I would simply click this star, name it, and it would be there for me in the future. For patients' diabetes, it seems like it's well controlled. And I can simply add in any text that I'd like to for that treatment plan. Under good control, period, no change in medications, period. As I mentioned before, all of our orders do have alarms on them. So if Jake is due for getting his lipids redrawn in a week, and that doesn't happen again, that won't fall through the cracks. Somebody on my team will reach out to him. Now, proactively, we actually even remind the patients that they have these orders due through automated order reminders. We do have patient handouts that come out of the box from HealthWise. You can, of course, generate your own custom handouts and utilize those as well. Maybe I'd like Jake to follow up with me in a couple months just to recheck those labs. So maybe I want to have a lab work follow-up appointment with him in 2 months. And again, that's going to trigger both a tickler for my staff to ensure that they contact Jake if he doesn't schedule with us, and also some reminders in Jake's patient app that he has that appointment due. Yeah. The other thing left for me now is to make sure that my charges are entered. We do have an E&M coder that's built right in. It looks at whether the patient is new or established, and we can indicate the level of complexity. The system will automatically generate that E&M code and insert it right into my billing tab. We can see here that not only are the E&M codes associated with the diagnoses, but several of the other things, such as the skin tag removal and CPT2 codes, are automatically generated. Once I sign my charges, billing is processed by my staff with Athena's rules engine to make sure the claims are clean and paid for submission. But additionally, Athena staff works with my staff, taking on work at scale that allows my staff to focus on just specific high-value claims. And we can see that in the workflow dashboard. Where my staff can identify high-value claims that require their expertise to resolve when there are any issues. Now, at this point, I'd like to move on to the ways that Athena Clinicals allows both my and Athena staff to monitor productivity in a variety of financial and rev cycle dashboards, including our insights dashboards. These insights dashboards let you view your practice's performance and even offer up warning signs of what to look for, and even strategies you can use to drive more revenue. Here, when we look at more collections faster, for example, there's a number of key performance indicators that we surface to help drive revenue. For see more patients, you can understand your visit volume, provider counts, and visit throughput trends month over month and year over year. The same thing is true for performing higher value services, relating RVUs per visit and monitoring RVUs, improving payer contracts, increasing collection yield, and getting paid faster are all available because of our ability to analyze payer and patient pay yield, as well as the drivers of yield loss. Switching back to our main screen, of course, there's other reports that you'll be interested in running, and we have a very robust report library that offers reporting tools from KPI dashboard to a library of standard reports covering everything from scheduling, billing, clinical data. It even allows you to build your own reports with our report builder. So there's no dearth of the ability to run analytics, a lot of which can be scheduled to run and delivered into specific personnel's inboxes. Related to reporting, we also offer up the ability to manage patients at a quality level across populations. So with our quality management reporting, we can identify patients perhaps that need help with our diabetes control, and then generate that group call campaign that I referenced earlier, where we can reach out to every one of these patients with a personalized letter saying, hey, looks like your diabetes is a little out of control. Please contact us to schedule a visit so we can get that tidied up. From here, I'd like to switch over to demonstrate our athenaOne mobile app. The athenaOne mobile app is an incredibly powerful tool that you'll have in your pocket. Now, as I mentioned before, the athenaOne mobile app is designed to help you take your work on the go when your laptop's not around, and then you're no longer restricted by your desk. Now, what we've added to that is a voice assistant, which is really useful to retrieve information and perform complex tasks, navigate through the system, and especially while you're dictating, really reduces the keystrokes and taps that are required. So to launch into the athenaOne app, I can launch directly from the app itself or from one of these widgets. Maybe I got a new urgent inbox item, and the system just drives me right over to that area. I can see, for example, that maybe I have this urgent message from my staff. And when I tap into that, I can see that maybe I got a message from Jennifer Jones. She's got some symptoms of a UTI. Right. I can take a look at that message from her, and maybe I know her and I'm comfortable prescribing her some antibiotics. So I'm just going to go ahead and do that. And I do notice that she's got an allergy. So I'm going to check on that and make sure that she's not allergic to the antibiotics that I'm going to prescribe her, and it looks like she's allergic to codeine after all. So at this point, I can simply say, hey, Athena, order macrobid twice daily for 5 days for this patient for diagnosis of acute urinary tract infection. The system goes out, places that order, adds that diagnosis to the patient's chart, and drafts this up so that all I have to do is click send, and it sends the prescription right over to the pharmacy. I can, of course, then use voice to also send a message back to the patient through the patient portal or app, or back to my staff if I want them to reach out to her. But we just make it quick and easy for that to be accomplished through voice commands. Of course, you can perform any of those commands using touching the phone as well, but just try to demonstrate how easy it is with voice. Now, we also embed voice as simple speech to text within our system. So here is April Fitz. Maybe I saw her earlier today, and I want to complete my documentation on her. She had come in with an injury to her leg, or some redness that she wanted me to look at. All I have to do is click this microphone button, and it takes me right into where I can start my documentation. Patient presents today complaining of pain and redness in her right leg where she scraped it a week ago period. She's noticed worsening redness over that time, and is concerned she has an infection period. She's had no purulent drainage and no fevers period. And I can simply swipe through to get to my next sections. If I'd like to, I can utilize a template so I can mix and match my documentation styles here within the mobile app. I'm not just restricted to voice, so I really want to make that clear. And personally, I also find it very easy to complete physical exam documentation using templates. As for her assessment and plan, add text macro skin infection. Patient state, she'll continue to monitor the wound with her daughter, period. Stop listening. At this point, I'm done with my documentation. I can simply add my orders to the patient's chart. Hey, Athena, add skin infection order set. So whether it's an individual order or whether it's an entire order set, the system can help you and be driven by voice commands to complete your ordering and documentation. And again, all I need to do is sign off on these orders. The final piece of the mobile solution that I'd like to show you is our new ambient notes. And with that, I'm going to need some assistance from my colleague, Dr. Kathy Rokavik.
Well, hi, Kathy Rokavik. I'm also a physician with Athena. I'm a family physician by background. Let's kind of go through a visit here. So I'm going to be seeing Todd Clark, and you see he's ready for the provider. So I can go into his chart just like you saw Todd do earlier, kind of review it before I go in to see him. You know, he's been here before. I kind of remember him. So I'm just going to go ahead and tap on that Start Ambient that you see there. It's going to bring up a consent, and this is just, you know, whatever your organization decides to do as far as consent to let me know that I am ultimately responsible for the content of this note. I'm going to hit continue, and then we're going to start our visit. Hey, Todd, it's good to see you again. I haven't seen you in a while.
Yeah, hi.
Hey, so what's going on today? What can I help you with?
Yeah, you know, I've got this rash on my arm, and it's been bothering me for a couple days now.
Okay. Have you noticed any changes since it started?
Yeah, actually, I think it started kind of as a smaller patch, but now it's really spread, and it's kind of, you know, stings and burns. It's like really inflamed. I've been trying to put some over-the-counter hydrocortisone cream on it. I think that's what it's called, but it doesn't seem to help very much.
Okay. Does it itch or cause any discomfort at all?
Yeah, it's really itchy, and now it's starting to burn and kind of hurt.
Oh, okay. Any idea what might have caused it? Have you used any new soaps, lotions? Have you been exposed to anything new or unusual?
Think. I haven't changed my soap or lotions, but now that you mention it, I was hiking last weekend with my dog, and you know, she's like 6 years old, but she still thinks she's a puppy, so she ran off into the woods, and I had to kind of go chasing after her. So maybe I came in contact with something when I was doing that.
Oh, yeah. You know, that could be. You know how those dogs are. What kind of dog do you have?
She's a lab mix. She's super cute. I don't know. She's a rescue, so I don't really know what the rest of her is, but yeah.
Nice, nice. All right. Well, yeah, it certainly sounds like that you may have gotten into something with Chase and her or so. Okay, and how have you been feeling otherwise?
Pretty good. Yeah, pretty good.
All right. I remember you've been in here a couple times for your asthma. Have you had any problems with that? Has that been under good control?
Yeah, actually, I think it's under decent control. After the hike, I had to use my inhaler a little more than usual. I think, just because of the molds and things at this time of year, but it seems to be getting better now.
Okay, great. Well, let's take a look at you. Oh, you on for 1 second. I have to check on something. This is just kind of show you that if I get interrupted, as we often do, I can just hit that pause button. I can exit out of this and come back. We're going to continue on with the visit. All right. So just looking at your rash. So it's just right here on your right forearm.
Yep, that's it.
Yeah. Okay. Yeah, that looks pretty irritated. Kind of raised red. Let's see. It's just located on the medial aspect of your right forearm. And if I measure it out here, it's probably about 8 centimeters by 5 centimeters. I don't see any drainage, and you don't have a rash anywhere else. It's just in this location.
Right.
Okay. All right. Great. And let me just take a listen to your lungs since you were having a little bit more of an asthma flare-up. If you take a few deep breaths, yep, your lungs sound clear. You have good air movement. I don't hear any wheezes. So just kind of keep using that inhaler as you need it. And certainly if you feel that it's, getting worse, you're having to use it more often, just let us know or come on back. So I think this is a contact dermatitis of some kind, whether it's, it could be poison ivy, could be anything that you reacted to that caused, the irritation. Sometimes even small changes in what you're using daily, but I think it was probably due to that hike. So just keep the area clean and dry as much as possible. I'm going to prescribe a more potent steroid cream, hydrocortisone cream. You'll use that 3 times a day until it resolves. If you're not seeing any improvement within the next few days, or if it's getting worse, please come on back.
Okay. All right.
Sound like a plan?
Yeah, it sounds great. Thanks. I hope it works.
All right, Todd. Good to see you, and take care.
All right. Thanks. You too.
So I'm going to tap preview the summary. Now, this is going to take around 30 seconds to actually generate that note. So here in this draft summary, you see I can actually select individual options here. So if I just want the HPI to go over, I can tap that. But in this case, I do want the entire summary to go right over. So I'm going to send that over, and then we'll take a little bit closer look at the generation of the note. And you'll notice, I intentionally did a little bit of small talk asking him about his dog. So here's our HPI. See, it did say he was hiking with his dog, but didn't talk about what kind of dog it was. So if it's not really pertinent to the visit, it's not going to record it. And you'll notice I kind of talked through my physical exam, and it did record that. I think some providers will be more comfortable with either using that template like you saw Todd use earlier, or dictating the physical exam after they leave the room. And then here's our assessment and plan. And you'll notice that it did break out the asthma as a second diagnosis. And it did include the plan. Even though I didn't dictate them necessarily in this sequence or talk about them in this sequence, it still put them in the appropriate place. Currently, this will not do the ICD-10 coded diagnosis. That is a future plan, and as well as orders. So it will not create the orders currently, but it will discuss them in the plan, and that is on the roadmap. More to come, but I think it's pretty exciting.